This is Frances Russell, and in this module, we will review early pregnancy transabdominal ultrasound scanning technique. So indications for this procedure include pregnancy or suspicion of pregnancy with vaginal bleeding, abdominal pain, syncope, lightheadedness, presyncope, or hypotension. The goal of this procedure is to answer a binary clinical question. And the question here is there an intrauterine pregnancy, yes or no? We want to rule in an intrauterine pregnancy. We don't want to rule out an ectopic pregnancy. So that is a very important distinction. Secondarily, we can assess for findings of ectopic pregnancy, including whether there's free fluid present, yes or no. We'll start off by talking about transabdominal ultrasound. So these are the probes that you'll use to assess for first trimester OB ultrasound. We have our butterfly probe all the way on the left here, and our Philips Lumify probe here. And then we have our standard cart-based probes, our C6 probes. So all of these probes allow for lower frequency but higher penetration, able to see deep within the abdomen. So the views you're going to want to see for transabdominal ultrasound will be the uterus and transverse and sagittal plane. Remember, in sagittal plane, you need to see the urinary bladder. You want to look at the left and right adnexa. And then you also want to be able to evaluate the uterus, whether there's a gestational sac, if there's a yolk sac, a fetal pole, if you see a fetal heart rate, measuring what that number is, and also measuring gestational age. For transvaginal ultrasound, you want to look in sagittal and coronal planes. You want to evaluate the left and right adnexa, and you also want to evaluate for fetal heart rate and gestational age. You're going to want the patient to have a full bladder, so you can use the bladder as an acoustic window to be able to see the uterus. And to start out, you're going to want to have the indicator towards the patient's right. You'll be in short axis orientation. So you want the indicator this way, and you're just fanning down into the pelvis. You want to be sure you're above the pubic symphysis, but you don't want to be too high up on the abdomen. So in this view, you're going to fan through. You'll see the bladder, or use the bladder as your window, and be able to look at the uterus here. So uterus, endometrial stripe, cervix, vagina, and then the rectum sitting back here, and then your pouch of Douglas or cul-de-sac back here. So on ultrasound, what we're seeing in short axis, we can see the uterus here. It's hypoechoic compared to the surrounding bowel and structures, and then a hyperechoic or brighter endometrial stripe. You can then rotate the probe 90 degrees so your indicator is here, which is going up towards the patient's head, and you want to fan left and right. So here again, you're going to be above the pubic symphysis. You'll be scanning through the bladder, and you'll be scanning left and right. In this view, you want to be able to see your urinary bladder. You can see uterus, so this patient has an anteverted uterus. It's coming up towards the top of the abdomen. The uterus is hypoechoic. You can see vaginal stripe here, endometrial stripe here, and this is your cul-de-sac or pouch of Douglas, and this is rectum or bowel back down here. So this is the appropriate amount of depth that you want to be able to see when evaluating the uterus in long axis orientation or sagittal orientation. So here we can see bladder, here we can see uterus, we can see cul-de-sac back down in here, we can see vaginal stripe, rectum is also back here. So before you even look at the baby or look at the uterus, you want to be able to evaluate for any evidence of free fluid. So you want to look back here to be able to evaluate that. Within the uterus, we can see a gestational sac. We can also see a yolk sac, which looks like a little Cheerio, and we can see a fetal pole. So we know that this pregnancy is within the uterus because we're also able to see the bladder to give us our orientation.